survey reveals that many women of childbearing age with chronic inflammatory or autoimmune disease feel that they don't have adequate information to make informed decisions about treatment and family planning. Here to provide some info for these women is Dr. Grace Wright, rheumatologist at New York University Langone Medical Center, along with Rosanna, a mom of 2 kids who's lived with rheumatoid arthritis for 30 years. Thank you both so much for joining us.
Thank you for having us.
So Dr. Wright, we'll get to some important information here in just a little bit, but Rosanna, starting with you, what were some concerns that you had as you were considering starting a family?
I've had rheumatoid arthritis for over 30 years, and I've dealt with the physical pain and discomfort of it. But along with that, I dealt with the emotional burden of not being sure if I was able to have a family of my own, which is something that was very important to me. So when I became an adult, I decided that I needed to take matters into my own hands, and I found Dr. Wright, who was very helpful with me throughout my family planning journey. And I discussed when I was ready to have children, so she helped me pre-pregnancy, during pregnancy, and after. And as a result, today my RA is well managed. I have a wonderful husband and 2 amazing children, and I'm really enjoying being a mother.
That is excellent to hear. I'm very happy that the family is successful, that you started one, beautiful family. So Dr. Wright, as far as, information that women might want if they suffer from this condition, what would you tell them?
It's important to speak with your provider. We want women to feel empowered to have this discussion with their healthcare professional so that they can get the information that they need to have a healthy pregnancy and to have their disease controlled before pregnancy.
Right, and with that, what were some of the biggest concerns that women might have had in the survey?
So the survey really highlighted the fact that women had many concerns and fears across the spectrum, quite similar to what we would see in other women. But the eye-opener was that 41% of these women then chose to delay becoming pregnant or to choose to not become pregnant at all. And 2 out of 3 also made the choice or believed that they could not breastfeed and manage their disease as well. 1/3 of women actually stopped their medications before they became pregnant or when they became pregnant, and only 41% consulted their healthcare professional. So a real disconnect exists between patients and providers around this very important issue.
Right, and why do you think that is? Why has communication around this issue been so lacking that it makes so many women question if they're fit to be a mother?
Well, it can be very overwhelming and fearful to have a disease, as Rosanna discussed, that causes so much pain and discomfort and disability, and women are concerned about whether or not they can actually become pregnant, and can they then sort of manage the pregnancy and have a successful life as a mother after the fact. And this fear often inhibits them from actually asking the right questions and talking to their doctors about this. So the AIM movement is really a platform that I'm here promoting with UCB's help to help women understand that there are resources. There is a website here where they can share stories, they can get information, and they can also get tools to help them overcome those hurdles and have the discussion that they need to with their doctor. And that website is aimotherhood.com.
Excellent. Well, in the last 20 seconds or so, Rosanna, I'll leave the last word to you. What would you give as advice to other women and mothers who may be struggling with the same things that you did?
I think it's important for women with autoimmune diseases to always have hope that they will be able to have a healthy pregnancy and healthy children. I think it's important for them to find a doctor that's a good fit for them to help them during the family planning process. And I really encourage women to go on the AImotherhoodmovement.com website so that they can see that there are other women who are dealing with the same issues that they are dealing with, so they don't feel so isolated and alone.
Absolutely. Well, thank you both so much for the information. Rosanna, of course, for sharing your personal story, and Dr. Wright for all the enlightening info.
Thank you.
Thank you for having us.
All right. We'll be right back.